Good afternoon, and welcome to today's webinar on resident and medical student advocacy. My name is Karen Labello. I'm the Director of Education for the New York Chapter ACP. And before we begin, I would like to review a couple guidelines. All participants will be on mute since we have such a large audience. Our faculty today is Linda Lambert. She's the Executive Director for the New York Chapter ACP. We also have joining us Pooja Vyas. She's our resident advocacy intern from Northwell Health, and Imran Chaudhry. He's our medical student advocacy intern from Albany Medical College. If you have any questions, please type it in the dialog box on the right, and I will read the questions following the session. We also received questions in advance from the online registration form, which will also be addressed at the end of the presentation. I will be uploading the presentation on both the resident and medical student website page on the chapter's website at nyacp.org, and handouts will be available also. I will now turn the presentation over to Linda Lambert.
Hi, good afternoon. Thank you for joining us. We're really excited to bring you a little bit of hands-on information about advocacy, and having a current advocacy resident intern and a student intern who just finished his rotation with us, I think will make it even more relevant to all of you. So I'm going to start by talking about advocacy on a more general global basis, and then we're going to bring it back down to both Imran and Pooja, who will talk about their experiences here. So I wanted to start out with understanding healthcare in New York State. What you learn and do during your medical school years and residency training all starts from policy. When you care for your patients and you understand something is wrong with either your workflow, with the system, you can help change the problems by voicing your opinions. And when you don't speak, someone else will. And it may be after something has gone wrong, and we surely want to prevent that. Next slide. So I want to begin by talking a little bit about today's political climate. There's been a lot of angst with changes in administration, both at the federal and the state level. We're in an election cycle here in New York with the state Senate and the state assembly just holding special elections on Tuesday, a governor election, and all of the state legislature up for re-election in November of this year. And of course, everything that you read each and every day about what's happening at the federal level. But what I want to assure you is what we see happening now is not a new phenomenon. What I think influences the feeling that this is just the worst time in history is the added pressure of the daily media focus, social media activity, hyping everything, good, bad, and indifferent, seems to make news incessant and somewhat distorted. Time and time again, over our history, you can see patterns of disagreement, unrest, and challenge to nominees, elected representatives, and the coverage of events. And so you need to bring to this climate your own understanding of the process and the fact that it is a representational government. And so there are a variety of sides that are covered as we move forward. So the New York chapter, I'll just cover really fast. Who are we and how do we represent physicians? Well, we are the largest of the ACP chapters. We represent about 12,000 general and subspecialty internists, including students and residents, those who are in private practices, in academic settings, and those in administrative positions. We have three core tenets. Every program, product, and service that we deliver from this New York chapter involve either education, advocacy, or public health and patient safety, and that does include practice management. We do a lot about helping physicians in practice understand changes in regulations that impact billing, coding, reimbursement, diagnosis standards, those kinds of things. That all falls under practice management. Our goal, and this has been my priority for many, many years, is to be at the table discussing issues and ideas and concepts before they are actually developed into legislation, so that we do not have to be reactive but we are part of the discussion, and we're going to show you some of that as we talk today about some of the examples. Within the New York chapter, our motto is always putting patients first, advancing internal medicine and improving patient care. And we know, we truly believe, it's the heart of what we do, that you always put patients first. Now, regardless of what the press may say or what a bad medical liability case may say, I think it's every physician's intent to care for his or her patients in the best way that they can. And our public policy focus really reinforces that belief. Our health and public policy pillars, which are underneath that advocacy core mission, really involve three areas, which is increasing access to care, promoting patient safety and quality of care, and improving public health. The New York Chapter Health and Public Policy Committee helps us develop our positions and policies. It's a 35-member committee. That committee reports to our 32-member board of directors, and every policy or position that we take goes through that deliberative process, represented by physicians from across the entire state in a variety of practices and in a variety of places within their learning component. So we do have students, residents, and early career physicians who sit both on Health and Public Policy Committee and on our council board. We work a lot through collaboration, through our committees themselves, through focus groups, but mostly with other industry partners, such as the Medical Society, the other specialty societies, the hospital associations, the Heart Association, Cancer Society. We are not a silo. We do not work alone. It is so important to represent patients in a broader perspective, and so we do a whole lot of work in collaboration. We're represented by 2 registered lobbyists, me being one of them in full disclosure, so I am a registered lobbyist. I'm not a bad person. I'm not the hired gun. The job of the lobbyist is really to represent the interest of their clients. You are not my clients. You are my members, because I'm the executive director of the chapter and do a whole lot more than lobby for all of you. But we are charged with trying to make some sense out of the crazy public policies that come through regulation and legislation in this state, and to represent your interests. We are a local presence. We have a very credible reputation here at the Capitol. We do have our office sitting at the foot of the hill and have pretty easy access to most of the leaders who are at the highest level. I'm not going to spend a lot of time on how a bill becomes a law in New York State. It's very complicated. And then once you think you really understand how bills become laws, I can tell you probably 10 times when it's diverted from that policy that you think is the way bills pass. And we do have a couple of examples that I think I'm going to mention in just a minute of how things pass really quickly without going through the normal process. So when you do look at this slide after the session is over, if you have any questions about the process itself, you can come to me, call me, email me, and I'll be happy to answer your questions. The advocacy timeline in Albany is pretty set. It doesn't change. The session always begins with budget introduction in very early January. By April 1st, the budget has to pass, and then we have another 3 months, April through June, of actual legislative activity other than budget. Most of the hot issues come up after the budget has been settled, but that doesn't mean exclusively. We have had some very hot issues come up while we've been focusing on the budget in the first 3 months, and it passes very quickly. The advocacy internships for our students and residents are month-long rotations here at the Albany office, and they only run January to June. I can tell you they're oversubscribed. We're not able to take everyone who wants to come and spend a month with me here, but we do our very best to try to make some fair decisions and bring in a fair number of students and residents. Fall is our health and public policy planning session for the coming year. We also have annual meetings with the chair of the Senate and the Assembly Health Committees and the governor's staff at the Health Department to really review their key issues, where we've been for the year, but more importantly, what their expectations are to pass in the coming year. And all year long, outside of the legislative session from January to June, we're meeting with administration, meaning the governor's office, the Department of Health, the State Education Department, and all of the regulatory agencies that issue a whole bunch of rules and regulations for you to follow in your position as a licensed physician and a caregiver. So why would you be inspired, we hope, to advocate for patients? Physicians are the heart and soul of the healthcare system. Physicians and all allied health professionals are in the best position to understand the needs of patients and to advocate for them, meaning articulate why things are good and why things are bad as they come up in the legislature. Physicians are trusted at probably one of the highest levels. Any of the public polls that talk about trust, physicians pretty much usually rank across the board high levels, although oftentimes it's only my own physician and not necessarily physicians across the board in some of the polls, but we know it's physicians across the board. But most importantly, policymakers need the wisdom, knowledge, and input of the experts, and you are the experts in healthcare. And the last point here is if you don't share that wisdom with the legislature and the regulators, others will, and most likely they're going to have a different perspective, so you can make a difference. I'm not going to spend a lot of time on this slide. This is just our Chapter 2018 legislative priorities. As I said, access to care. We're doing a lot of work in physician shortage areas like general internal medicine and geriatrics. We're dealing with physician burnout and resilience. We continue to look at liability reform, which really is impacting the number of physicians who stay in New York after their training. Under quality of care and patient safety, we have a number of issues that also go into scope of practice. We're going to talk about one or two of them in a minute. Public health, we do a ton of work around tobacco. Medical marijuana is a huge upcoming, huge discussion. Whether we remove medical and allow just marijuana smoking in this state in general is very much on the public agenda. You'll be seeing a lot of news reports and stories about it. Some of the states around us have removed their medical marijuana requirements and have just legalized marijuana. So that is one that is going to be, I think, increasingly garnering attention, and we'd love to hear your views as you all move forward into your practice settings. Community paramedicine and others are all part of that. So we have many ongoing scope of practice issues. Comprehensive medication management is just one we selected out of the batch because it happened to be both in Imran's and Pooja's time frame here. This came up under the budget proposal, but it is living on outside of the budget because it's also an independent bill. And this would create protocols for a physician or nurse practitioner to enter into a written practice agreement with a qualified pharmacist to administer comprehensive medication management for patients who have not met clinical goals of therapy. In common language, I can tell you it does not give us enough descriptors of the types of services these pharmacists can independently perform. It does not carry enough tight information around communications needs. In my mind, if there's going to be some sort of change in medication by a pharmacist, there should be immediate notification to the physician. I think the budget bill as drafted said within 7 days. A lot can happen in 7 days, and we don't think that that's good medical care. So we continue to look at that bill and explain why it's not acceptable in its definitions. Similarly, community paramedicine, in an answer to the shortage, the growing shortage of primary care, have been some of the rural hospitals who want to enable EMTs to do a lot more than simply arrive and transport the patient to a hospital. As you can see in this little paragraph, the scope of treatment, diagnoses, extended training, and communications are extremely broad and very poorly defined in this bill. And we really are concerned that EMTs doing a lot more without very well-defined scopes is not going to extend our patient safety issues. It may impact them in a negative way. And retail clinics is the issue of the CVS's and Walgreens and Walmarts of the world establishing a clinic within their building walls. I don't have time to go into it today, but I have some pictures of one of the retail clinics that I visited in Florida when I was there recently, and I was just truly horrified at the lack of walls in the space itself, so that people who may have been sitting in the stacked chairs waiting to be seen by the nurse practitioner literally could be coughing, sneezing, spewing germs into the retail setting, which was less than 2 feet behind it, and T-shirts were being sold, and it just set up a whole number of bells and whistles that went off in my head. They also were actually posting the patients' names who were in line and up next, which in my view is a HIPAA violation. So we have huge concerns about retail clinics. Hospitals who establish ambulatory care facilities have very strict rules in New York State. We would never accept anything less for a retail clinic if it's delivering proper medical care to hold by standards of business operations within a healthcare setting. Next one here. Workforce capacity. This is really about ways we are looking to enhance the ability to get to more physicians staying in New York. Many of you may not know about Doctors for New York. I can tell you Pooja has spent probably this last entire week working on our documents to post on our website. But this is funding that's available to residents who are completing their training, willing to stay in New York, worked in an area, a shortage area, and commit to 3-year time frame and receive $130,000 in loan repayment. More than $57.4 million has already been spent on this program to 445 recipients. It has been oversubscribed every year for the last 3 years. We continue to work hard to make this a simpler process, and that we continue to not only keep the funding, but increase the funding so more people can be accepted into the program. We are looking at other workforce capacity, especially in primary care, geriatrics, other specialties, even surgery is shortage. That's not our issue, but we support our colleagues where shortages exist. And we do keep a very special focus on the continuing ability of physicians to practice in whatever setting they choose to practice in, including small and independent practices that may not be affiliated with large systems or hospitals. So, steps you can take. You want to understand that this is not a new world of politics. What you read about and hear about every second on the news about the President of the United States and the Governor of New York is not an enigma. It is probably politics as normal. It's important to know solid advocacy based on the right outcome is the best we can do and the best we can expect. We can know the challenges of any issue. It's important to understand the opposition, because if you don't know what your opposition is, you really can't mount a good argument in terms of why the bill should or shouldn't pass. And we need to offer tangible next steps. We have to participate and develop local connections and coalitions. This is not an activity that is most successful when done alone. It's most successful when it's done in groups of constituents working within a representative's region. I think we need to remember to manage our expectations. Many of these pieces of legislation don't get passed overnight. Some of them take 17 years to pass, as in my longer presentation we explain, and some only take 3 days, depending on who's pushing it and where it's coming from. The 3-day one was iStop. I hope everyone on this phone call knows what iStop is, because it forces you to do something each and every day that didn't have to be done prior to 3 years ago. But that one was one of those, don't follow the rules in terms of time frame. This one got passed very quickly. So stay informed, participate, and you do have the ability to influence. And so I'm going to turn it over now to Imran, and he's going to talk about how medical students can get involved.
Hi, good afternoon, everyone. As Linda said, I'm briefly going to discuss how I, as a medical student, got involved and how, medical students in general can get involved. So one thing that I took part in as a first and second year medical student was organizing medical student advocacy days as part of the college. And we organized it for New York State. We invited other medical students across New York State to come, and we just picked a day in February, picked a Tuesday, which is the Capitol's lobby day. And we all kind of went and, we advocated on various issues ranging from public health to human rights, as well as to access to insurance. That's one aspect you can take, within your school now. Now as a medical student, as well as in the future, you can also get involved in any of the following organizations. Obviously, ACP is one of them, but the family med doctors have their own, pediatrics has their own, obstetrics and gynecology has their own, and there are many other organizations out there too, but everyone has their own advocacy initiatives, and you can find things that kind of fit your own specialty interests as well. And then as an individual, you as a medical student carry a lot of weight, even though you may not think it. And so you can individually set up meetings with your state and federal representatives, or write letters or make phone calls. And, they'll be happy to hear from you. One, because, they're a constituent, but you're bringing to the table this other aspect because you have this knowledge and background as a medical student. And that'll only get more important as you go future in your career as a physician. So this is briefly kind of the various things that I was able to do during my 4 weeks here as a medical student intern. When I was here during the month of March, primarily was the height of the budget season, since the budget had to be passed by April 1st. So I worked on a lot of different of the aspects of the budget health components that Linda already talked about, like comprehensive medical management and community paramedicine. I also went up the Hill a couple different times, sat in on the Senate as well as the Assembly Health Committee meetings. I got to, see discussion on a variety of different health bills, and see kind of how legislation works in practice. And then, I also got to meet with my own representatives, Senator Marcelino from my hometown in Long Island, with their office, and kind of advocate, both on behalf of NYACP as well as me as an individual, to kind of the things that we cared about from the budget. And then, as an intern here, you actually also get to see kind of how the NYACP works as a chapter. And so I got to sit on the council board meetings as well as the Health and Public Policy Committee meetings, and kind of just got to see how physicians from all across New York State at different points in their career got to bring to the table different viewpoints and different ideas, and how the NYACP makes things work in that fashion, and commit the ideology forward in that way. So now I'll give it off to Pooja, who will kind of talk from the point of view of a resident.
Hey guys, my name is Pooja. I'm a third-year internal medicine resident at North Shore LIJ in Long Island. I've been doing my month-long internship here with Linda and the entire staff at ACP, and I'll talk to you about pretty much the same things. The internship itself is very important. It provides you the opportunity to understand the legislative process, the health policy, understanding advocacy. While you're here, you help out with research, analyzing the current issues in medicine. You understand medical education policy. You talk about ongoing advocacy initiatives and how you can develop materials for your advocacy. Where we stand as physicians in the changes in healthcare is important. What you have to say matters because it affects your daily work, your patient safety, and the quality of care that you ultimately deliver. It's important to understand that advocacy will help shape the future of healthcare, and it'll influence what happens on a day-to-day basis, especially here in New York. So why should residents get involved? You may not realize how policy affects your day-to-day work as a resident, and you want to make sure that it's something that you understand, especially since eventually you'll become an attending and will need all the information you can get. One example I have is that we use iStop every single day, and where did it come from? Like, it didn't come from a medical professional or somebody in government. It came from the district attorney's office because they were basically sick of the crime, destruction, the deaths related to opioids. That turned into law within a day, and then afterwards we were kind of there fixing any of the problems that came about with it. That's a law that didn't come from a medical professional, but it affects you as a medical professional on a daily basis. So it's important to understand that. The other thing that we always talk about is patience over paperwork. I'm sure we all have complained at least at one point that there's more paperwork and we don't get enough time with our patients. That's exactly the proposal that we're going to focus on when we go to Washington, D.C. this year with ACP on our Leadership Day. And we'll be meeting with our House of Representatives there in Washington to discuss this exact issue and how it affects our daily workflow. As a resident, you see the pros and cons of practicing medicine in the state of New York. With your daily experiences, you are at a unique point where what you say matters because you are the expert. You can offer education, you can offer your personal perspective. What you say matters because you are the experts in it. So how can a resident get involved? Don't want you guys to feel that your efforts go unnoticed. There are so many people at the national and the state level that make a difference every day. Our New York ACP chapter is a great example. Linda and her staff do so much on a daily basis that affects what happens in New York, especially with healthcare. You want to understand that a well-intended idea can become an implementation nightmare. It'll force you into like new practice guidelines. Clearly, it changes your education mandates. You want to get involved locally, stay in touch with your ACP chapter, stay up to date on the hot topics. You want to visit your capital, speak with your representatives, maybe attend public hearings, attend conferences, do your research, know your own viewpoints, and then be able to communicate those. You can do things once in a while, like attend a leadership day in Washington, enroll with the Internal Medicine Advocacy Network. It's important to realize that if you don't help defeat negative legislature, then you're kind of stuck with it. And you want to just make sure that you're involved when things like medical liability, screening, gun control, iStop, mandated reporting, all those things are involved.
So you want to finish up, or I'm going to finish up? Can you go back one slide, Karen? Just wanted to add one point about public hearings. Pooja actually on Monday just sat probably for about 3 hours at her computer listening to a public hearing on physician-assisted suicide, aid in dying. Literally, I would say 5 hours of testimony by people, both patients and providers, representing both sides of that issue, who were trying to convince the Assembly and Senate Health Committees of their point of view. It was very split. There was fair representation on many, many aspects of the issue, both pro and con. And so you don't always have to physically attend. These public hearings are often published on the internet, and you can find them if you want to. And again, we can help you do that. So I just wanted to return to that for a second. And then I think our final slide we'll leave up and not really cover because you can read this, and we'll start to get into Karen and her moderation.
Great. Thanks, Imran, Pooja, and Linda. That was a great presentation. We have a few questions that came in, and if anybody on the webinar would like to submit a question, please type so in the dialog box on the right-hand side of your screen, and we'll read it in the order they come. First question is, what would you say is the most common issue medical students can impact?
So from my perspective, I don't think a lot of medical students necessarily understand the profession of medicine at the level that they kind of need to impact those issues necessarily. But I do think they have a very good understanding of public health issues. And issues that directly impact patients on a daily basis, from whether it be public health or medical issues that patients face. And I think those are the things that medical students really should be advocating for. Those are the things that that I, as well as my fellow students at those medical student advocacy days, advocated for, because you can bring a lot to that discussion. Whether you realize it or not, you actually have a lot of knowledge with regards to public health. I'm sure that many of the people who are listening to this, that you have a lot of knowledge about what your positions on the gun control debate are in the country right now, and that's something you can advocate for, from the position of a medical student. Things that I advocated for from a public health aspect were things, trying to prevent allergy outbreaks in, local areas. That may seem like a very simplistic thing, but understanding the very serious complications of people who have allergies being in areas that they could be exposed to those allergens, and kind of relaying those facts to our representatives is really important. And there's a whole wide variety of issues as well that, you can look into from your legislators into your state legislature. But I really think public health is really where it should be from a medical student point of view. And as you go forward in your career, you continue advocating for public health. I don't think that should ever go away. But then as you gain experience as a medical professional, you'll have much more kind of background to advocate for that as well.
Yeah, and to add to what Imran said, it comes down to how you personally feel as a medical student or even a resident. He brought up the example of gun control. Just like that, every day there's probably something that you think of that you're opinionated about, and that itself is where advocacy can begin.
Great, that's great perspective from both of you. The next question is, how can medical students get their classmates interested in activism?
So I remember when I started medical school and I had zero idea of what it meant to be an activist or an advocate. And it was really just, a lot of the time it was word of mouth within my school community. It was just kind of this idea that, do you want to get involved in trying to kind of talk about these issues? And I think a lot of the times we hear a lot about things on the news, or we read about it online or social media or whatever, and a lot of the things make us feel either depressed or hopeless or like we can't do something about it. And I feel like for me, as a medical student, you really can start doing something about it. And the way you can kind of get, your classmates interested is just hold some sort of conference about it, hold some sort of meeting about it, just send out like a campus-wide email just being like, we want to talk about advocacy and gauge kind of public interest in it. Get food, and just have kind of it doesn't have to be a formal discussion or anything, but just kind of gauge the interest, and you can go from there and kind of figure out what you want to do as a medical student.
So I just made a really quick list of the kinds of public health issues, because Imran is right, that's where it's easiest to begin. But I can tell you how much time has been spent by this chapter on smoking cessation, obesity, healthy lifestyles, adult vaccinations. All of these things you encounter each and every day in patients you see who are not really taking advantage, of the health that's available to them, or living a style that's important. Some of those very generic issues are the ones to start with because they're the toughest to conquer.
Great. So we have time for two more questions. The next one is, I would like to know if an advocacy internship after medical school can be helpful before internal medicine internship.
So as Linda stated, the internship here at the NYACP runs from January to June. I highly recommend you do it as a fourth year. But if you have space in your schedule that, I guess, your vacation or whatever it might be between when you finish fourth year and when you would start residency, if you are, if you're willing to take that time to come here and do the internship, that's fine. But I would want you to be committed to it if you were to come here. And I think it's easier sometimes to do it when you're still a medical student because you might be in the right mindset at that time. But, I do think it is invaluable information you can get as a medical student. I think there's a lot of things we learn in medical school, whether it be like the pathophysiology of disease or how to treat things or, you know, how to talk to patients and those kind of aspects. And those are great. And those are like the core, you know, aspects of what it means to be a physician. But this, you know, how public policy affects our careers is also a hugely impactful and important part of it. And I think the earlier you can get involved, the better. So if you can, you know, I would highly recommend it.
I would also emphasize that the earlier you get involved, the better, but it's never too late to get involved. So even if you don't get the opportunity as a medical student, you may have the opportunity as a resident to choose this as an elective. And even if you don't do the internship, there's so many ways that you can get involved, and even just keeping in touch with the ACP chapter, they will always find ways for you to help out and be involved and participate.
Great. Thank you, Pooja and Imran. And the last question is, how do you find the time to advocate as a resident?
I think it comes down to the fact that, one, there's so many opportunities and sometimes they go by without us noticing. So staying in touch is the most important thing you can do. Keeping up with our ACP or any other advocacy organization that you feel close to. With ACP, on their website, they always have things updated. Even if you do something once a year, it still matters. Like if you can go to a conference or participate in Leadership Day, or even write a letter to your representative voicing your opinions, the little bit matters. So it comes down to how much time you have and how much time you're willing to allocate. But there's always a way for you to get involved.
Right. Thank you. Well, our time has been is up, and I'd like to thank once again Imran, Pooja, and Linda for this very informational webinar. Once again, I'd like to say that the webinar will be hosted on the resident and medical student page on the chapter's website at www.nyacp.org, along with the handouts. If you have any additional questions, please contact me, Kay Tucker, at nyacp.org. Thanks, everybody, and have a great afternoon.